Hello and welcome everyone to our afternoon session on climate resilient and environmentally sustainable healthcare facilities. This is another webinar of our technical webinar series on climate change and health. My name is Yiqi. I am a technical officer in the climate change and health unit at WHO. As you can see here, we have two times. So one has already taken part today in the morning, and the one you're visiting right now, of course, is the one in the afternoon session. Just as a note, it's not that you missed anything, so these are not consecutive sessions. These are sessions that provide the same content, but we have different country experiences. So if you are interested in the country experiences that was presented in the morning session, you're very welcome to watch the recording that we provide on our website. So this is our overall technical webinar series. As you can see, we are now halfway. So we have already done a couple of webinars and we will have more webinars coming up, and you're welcome to scan the QR code here on the slide, or you can also enter the link to enter our website, and then you can register for the upcoming webinars, or you can also watch the recording of the ones that we have already hold. We have interpretation. Now for this session in the PM, we have interpretation in English, French, and Spanish. So if you require interpretation, you are very welcome to go to your Zoom. You can see the bar and see the interpretation button. If you don't see it, it's probably under more. So you click on more and then you go to interpretation, and then you can click the language that you're most familiar with. Also, as always, a couple of housekeeping rules, I would say. So we have set up this not as a webinar, but as a meeting to facilitate open discussion. So you have the option to unmute yourself and turn on your camera. But if you are not speaking, we would kindly like to ask you to keep yourself muted, just so that we can minimize background sounds. So then agenda for today, I realized I just put on the AM session. I'm terribly sorry. Let me put on this for the PM session. So right now we find ourselves in welcome and housekeeping, and in a couple of seconds, I'll hand over to my colleague, Dr. Amy Savage, who's a technical officer in the climate change and health unit at WHO. Then we're very delighted to have Mr. Saleh Rababa, a colleague of mine from WHO Eastern Mediterranean Regional Office, to give the main presentation on climate resilient and environmentally sustainable healthcare facilities. This is then continued by two country examples. So we have the pleasure today to have Dr. Américo José from the National Institute of Health Mozambique to present on their country's experience in introducing and implementing climate resilient, environmentally sustainable healthcare facilities. It's always a handful to say these words. And then followed by Mr. Maoro Beauvogui, who is a COP26 National Director from WHO Guinea, also similarly presenting on the Guinea's experience. Then we will have an interactive group activity. So those who have already been with us in the webinars are familiar that we usually do smaller breakout rooms so that we can discuss in smaller groups. Afterwards, we'll come back to the plenary, talk about what we have discussed in those smaller groups before then we come to the close. So with that, I would like to kindly hand over to Dr. Amy Savage.
Thanks so much, Yiqi. And many of you probably have already joined us for other webinars in this series. So you know that here at WHO, we're really placing a high importance on this technical series to support climate change and health work across the globe. So we have been working for decades on highlighting the risk of climate change to health and developing a comprehensive support package to address the risks. And these technical webinars form part of that support package. The work on climate change and health has really been elevated even more in recent months. We had the first resolution on climate change and health in 16 years, adopted at the World Health Assembly earlier this year in May. Also at the last WHO's new General Programme of Work was approved, and it includes climate change as one of the 6 top-level objectives of the programme. So the importance of this work to protect people's health from climate change is very clear for WHO, for our member states, and for the global health community. And we can see that it's really only increasing in importance. Over the last few months in this webinar series, we've looked at understanding what are the health risks of climate change in your countries by conducting a vulnerability and adaptation assessment, and then looking at developing a plan, how do we address those health risks with a health national adaptation plan, and to build a climate resilient health system using WHO's operational framework, a climate resilient and low carbon, I will add, using the operational framework. So what we've really tried to emphasize with the webinars is that they're also grounded in country experiences, and that we're really just as interested in hearing from you as we hope that you are hearing from us. So today we'll follow on from the previous webinars and look at some of the interventions for implementation of our plans. So today particularly we'll be looking at how can we build climate resilient and environmentally sustainable healthcare facilities. Healthcare facilities are, of course, critical, and we often say that they're the first line of defense against climate change. So drawing on all our years of experience in climate change and health and piloting this work in many countries, in 2020, WHO published its guidance for climate resilient and environmentally sustainable healthcare facilities. And then in 2021, we published a checklist to help assess the vulnerabilities of healthcare facilities in relation to some specific climate hazards. Healthcare facilities are, of course, exposed to climate hazards, which can result in reduced quality of care. And at the same time, healthcare facilities also generate environmental impacts and contribute to greenhouse gas emissions. So this WHO guidance, we're really aiming to provide practical tools and examples of interventions to ensure safe and quality care, even in the face of the effects of climate change. But again, we really look forward to hearing the country experiences that will be presented today. And we want to hear from you and your experiences with improving the climate resilience or reducing the environmental impact of your healthcare facilities when we get into the small group discussions and the breakout rooms. So with that, I'm really pleased to hand over to my colleague Saleh Rababa from the Eastern Mediterranean Regional Office to walk you through the WHO guidance and the approach. Thank you.
Thank you so much, Amy and Yiqi, for the introduction and introducing me. And may I say good morning, good afternoon, and good evening for all of you connected from everywhere around the world. So, and welcome to another webinar on a very interesting topic, and I think more or less diving more to a little bit more specific topic, zooming into one of the components of the health system, trying to capture more practical, let's say, solutions, interventions, or actions that you can take. So, as mentioned by Yiqi and Amy, this is just a continuum of many other webinars that have presented many aspects of climate and health action, starting with V&A assessment for the whole health system or at community level, with building national adaptation plans, finance, GIS, and other important issues. And we're not flying very far from that. We'll be looking into the health care facilities itself, how we can implement and have some interventions and actions to enhance the resilience and sustainability of the healthcare facility. So I will be going through slides, but don't mind or bother following up each and every slide. Myself, I don't even do that. I kind of hate slides to one or two extent, but we'll try to make it more focused into what we actually want to deliver to you and what actually you can grab back home after this webinar and try, I don't know, maybe to advocate for, to implement, or to take it home, or to work on it. So if you attended several other webinars or trainings or workshops, I think you might be familiar with this picture, with this graph that shows in one way or another that climate change is affecting health in so many ways, interacting with many factors around us, with many factors within ourselves, our communities, different pathways, and eventually affecting, don't want to be so brave to say that all aspects of health, you name it, whatever you think about, it could be linked to climate change. Mainly some things we already know, we established, and we've seen it. Others, we're trying to understand more and more. But what no one can deny is that this is an extra pressure on healthcare facilities and healthcare workers. Adding to that direct effect of climate change and climatic crisis or hazards or emergencies on the healthcare facility itself. So the poor healthcare facilities are facing, the direct effect of floods, storms, and whatever on their buildings, on their operation, on the workers within the healthcare facilities. Adding to that, the pressure coming from the affected communities. The people are coming to healthcare facilities to seek care, to seek help after a flood or after a heat wave or after whatever climatic crisis or emergency is happening. So eventually, the healthcare facility will be loaded, will be pressured. The main question would be: are the healthcare facilities ready? Are they resilient enough to withstand such pressure, or to at least keep providing the basic requirements of good quality services or health help, let's say, or needs to the communities or not? This is what we want to achieve eventually, is to say, yes, they are able to do that. They are resilient, and they are able to continue serving the community. And this is not something to come. This is what we are actually seeing. These are only photos of two, let's say, examples from only two countries from one region. And to add, it's only one climatic hazard. It's only a flood incident. So imagine being treated or taken care of after such crisis in a healthcare facility that is looking like this, or even you're lucky if you can even have access to such care. So it's very important to try to enhance the abilities of the healthcare facilities. We don't want to end up with nowhere to go or no health shelter to those in need in such scenarios. And this is, not something we are preparing for the future. This is something we're seeing now. Many cases, many examples, many unfortunate events have been going on in different parts of the world, and we need to really take an urgent action. So what exactly do we mean by a climate resilient healthcare facility? What exactly should a climate resilient healthcare facility look like, or what it should behave like during a climatic event or climatic crisis? This figure might look also familiar to many of you, and might look some way complicated, so many lines to some of you, but it's fairly simple. It's showing you how healthcare facilities or even systems behave under shock, under pressure, under crisis, under emergency, including climatic ones. So imagine this. So on the left side is the health system or facility capacity. On the right side is its level of resilience or adaptive capacity. And here, starting from the left, it's normal situation. The healthcare facility is providing its normative services under normal conditions. Nothing is serious, but then you either have a direct shock, a crisis, and an emergency, a flood, let's say, or over the time you're facing a stress or a pressure, and now you will be dealing with more pressure or more cases coming at once, or an emergency is happening, a climatic crisis is happening. The level of your preparedness or resilience will shape out how you will be responding and how will you be recovering, or how will you be coming back, if you will be coming back from that emergency, or if you will be collapsing, coming to an end. So we can close that healthcare facility, or it will be no longer able to function or to serve the community. So it's fairly normal to at least at the beginning in the response stage is to have a slight drop in your performance, in the quality of the services, take into consideration that you're living the emergency, you're dealing with more cases, with more pressure, with limited resources during the active stage of the response, or the active stage of the emergency itself. But if you're not already prepared, if you're not already resilient to that situation or to that scenario, you will eventually collapse. You will not have the ability to get back on your feet, to recover. But if you are, kind of aware, kind of expecting that, you anticipated that this might happen and this should be done before that happened, you will be recovering back to your normal situation after a certain period of time, and even better, learn from that and transform into a better place. And that's what we want. That's what we promote. That's what we recommend healthcare facilities to do through many tools that we will be viewing. So you will be trying to reduce the risk, your exposure, and the vulnerabilities around you, and try to build your own adaptive capacity and enhance your resilient capacities in order to keep providing the services and keep providing health help and healthcare to your communities. And on a similar way also, and one might argue that the same healthcare facilities or the same sector that is protecting the health of the communities should not impact the health of the community or the environment, its surrounding environment, negatively through the emissions. So it is, I think, one of the priorities, and should be one of the priorities of the health sector, is to protect the community from the emissions, to protect the environment that it is functioning within from the emissions, and try to lower and to minimize its emission to the lowest level possible. And this goes, in the same logic that you need to identify some actions, some interventions to lower the emissions on different scopes, from different sectors, from different aspects within the healthcare facility. You might want to assess these. Some will start from the top down. Some will start from bottom up, starting with some sectors, some parts of the healthcare facilities, and then building up together into a more comprehensive understanding of where the emissions are coming from. Is it from energy? Is it from the supply chain? Is it from my transportations, my practices? And try to lower them as much as possible. And where we want to reach eventually, we want to reach to this little tiny corner, green corner, where we have low greenhouse gas emissions and preferably net zero emissions with a high quality performance or high quality health services or performance of the healthcare facility and system. And this would be the ideal situation, or at least try to push into that way as much as possible. And it will depend where you actually are coming from. Is it are you standing on a good baseline of the quality of care, but you need to work on lowering the carbon footprint or the emissions or enhancing the sustainability practices within the healthcare facility? So you'll be going from 5, for instance, path 5. Is it both? You need to work on both. Is it you need to enhance your capacities, introduce more technologies, and introduce more, let's say, tools within the healthcare facility? You might want to take into consideration the emissions and sustainability of these and try to introduce some clean or, say, eco-friendly, green, sustainable ones in order to go up and not going up in performance and not going also incrementally in emissions, only trying to enhance the performance and not increasing the emissions. And this is not something new, not something parallel to any other work on climate change and health on the overall national level. It has been mentioned that we've been talking about V&A assessment, health national adaptation planning, lowering the carbon footprint of the health system, assessing that, building a plan of action. The work on healthcare facility is part of that. It's not outside of that. It's just a more focused approach on one of the most important parts of or building blocks of the health system itself, the healthcare facilities. The first, one might say, the first and last line of defense in face of climate change. So this is also to be considered at every time. So it's part of your overall health system resilience and sustainability, and when you're lowering the carbon footprint of the healthcare facility. Within the healthcare facility also, we are speaking on different and widely spread activities. You have the workers or the staff of the healthcare facilities. You have the energy used within the healthcare facility, the infrastructure, the way of building the healthcare facility, the technologies, the supply chain, the consumables, the wash aspects, the waste management aspects of the healthcare facility. What should I do with all of these components and to enhance their resilience, to enhance the adaptive capacity, their preparedness? So here comes this document that Dr. Amy mentioned, which contains a list of interventions and recommendations, actions that you can implement in your healthcare facility on all of these components, on all of these 4 components, on both the resilience side of the story and the environmental sustainability one also, that eventually will increase the resilience of your healthcare facility, protect and improve the health of the communities you're serving, optimize and enhance your efficient way of using resources and tools and operations, and at the same time minimize any waste or any let's say negative impacts coming out from the facility itself. As mentioned, eventually these interventions will enable you to have a resilient healthcare, an environmentally sustainable healthcare facility, which means you will be ready, you will be anticipating and ready to respond to, cope with, recover from any climatic related shocks or aspects. And at the same time, you're not doing any, let's say, or minimize your harm contribution to the community. And this is the ultimate goal of any intervention that you will be implementing. So we decrease the vulnerability and increase the capacity of the health system to eventually have a resilient healthcare facility. The tool will be presented to you in terms of lists of interventions, tables of interventions on the 4 components of the healthcare facility, on the both sides of resilience and sustainability. And it will look like this. For instance, this is a very quick example on the interventions listed for health workforce. You have also on the resilience part, and this is for energy on the resilience part. This is on energy on sustainability part, and the list goes on. If you went through the document itself, I think the first impression you will see or you will have is that this is too much. And this is, a dream if I want to implement all of these. And it is very generic, and I agree. It's a lot. It's a long list of interventions and recommendations, but it's not intended for you to follow it strictly. This is designed with a room of flexibility, designed with a room of, let's say, adaptation to your own context, and also I can add a room for your own creativity. It's always recommended, and I personally recommend that, is to go through this list of interventions or recommendation and try to adapt it to your own needs, to your own context, to your own situation. If you think one of the interventions is not relevant or cannot be, or this is not the way we do it here, you can change it. You can delete it. You can add whatever you feel is more relevant to you, or you need it more. Don't be afraid of changing things, even if it is coming from WHO. It's totally okay. So these lists will be helping you, in your this process to eventually have a climate resilient environment and environmentally sustainable healthcare facility with a long list of these interventions and recommendations. If we look into these steps, 1, 2, 3, until to 5, one might ask that, what about if I already have something, at the baseline, already established or already there? Or what if I need to understand more what exactly I need? So I need a help to establish the baseline. And this is what is intended with the second tool we're presenting today, and what Amy mentioned that came out in 2021, which is a checklist to help you assess or understand your baseline, understand the baseline vulnerabilities in the healthcare facility, or how the different scenarios of climate change will be affecting or impacting the healthcare facility. And there are also other tools available to help you establish the baseline or understand or calculate the baseline of your emissions, the carbon footprint emissions from the healthcare facility. And this tool is complementary to the previous one. So this one will help you to understand what is your baseline, what vulnerabilities are there, how the healthcare facility will be affected by certain scenario, floods, heat waves, droughts, storms, wildfires, and what impacts are expected on the level of healthcare facility, with the same logic or with the same or similar structure, speaking on the 4 main components of the healthcare facility itself: workforce, energy, infrastructure, wash and waste, and under different scenarios. So you will be seeing lists of questions that you can take, also adapt, review it, add, change, take what is relevant to you. And using these, you can identify, for instance, what you're seeing is part of the checklist or questions to be asked to assess the vulnerabilities of healthcare facility to flood. So eventually, you'll be asking some questions to understand how the workforce or the staff within the healthcare facility are vulnerable to floods. If a flood will hit the facility, are they unprepared with a high level of vulnerability? There is some basic work, there's some things that could be enhanced with a medium level of vulnerability, or very prepared and well informed about that, and action is taken, and no further action, so the vulnerability is is low. Similar goes to other aspects of or components of the healthcare facility on different scenarios. And also to understand impacts, different direct impacts or indirect impacts of climate of these scenarios on the healthcare facility, looking something like this, major, moderate, or minor impacts that you can check and say that this will be happening or this is expected to happen at or possible to happen or to impact the healthcare facility with under these scenarios. And so eventually you will have an idea on what is missing there, what vulnerabilities are there, what impacts are there, and then you might go back or in parallel choose from the first document with a list of interventions, the relevant one, the needed one, the priority ones to implement these within the healthcare facility. And also keep in mind that some or many of these interventions or recommendations are win-win situations. So you can implement these even without understanding or let's say definitely saying that this is needed or not. And as you saw, we got you covered for at every step from the baseline, from defining priorities, what to implement, how to implement, who should be with you through different tools, and eventually also in monitoring and evaluation of your implementation and progress through different tools, and of course through our teams within the headquarters, regional and country teams. So this is an overall view of these tools, how to use these, some interventions included in these, how to synchronize between them, and how to approach a way to enhance the resilience and sustainability of the healthcare facility. And it's, I think, one of the most important parts of the health system itself, because eventually God forbid, if something happened even for me or for my family or the community I'm living in, I'll be seeking the help from healthcare facility. And if these cannot help, no one can help. So apologies if I talk, I think, too much, or if I talked a lot, but very glad to be part of this. And thank you all for listening. So, and back to you, Yiqi.
Thanks so much, Saleh. It's always great to hear you presenting. Probably already said that for the AM session, but I always enjoy it. And yeah, that was a really great overview of the guidance. And I think my colleagues have posted it in the chat, so feel free to look into it. And yeah, it's a quite detailed document. Yeah. And yeah, with that, I will now move to the next agenda point. And I have the pleasure to introduce Dr. Américo José, who is the coordinator of the Climate, Environment and House Platform of the National Institute of Health, Mozambique. Here he is, Dr. Américo. So yeah, over to you, and you're welcome to share your screen. Thank you.
Thank you so much. Good morning, good afternoon, everybody. I'm having some technical problem here. Just a second. Yeah. Okay. Good morning, good afternoon, everybody. Sorry, just fixing here some point here. My name is Américo José. I work for National Institute of Health of Mozambique. I have here my colleague that make part also of National Institute of Health, Mozambique, and local WHO and other institutions that participated in the process of implementation of this climate resilience and suitable healthcare facilities. So basically today, I'm going to present to you some experience that we have when we established this activity here in Mozambique. This is a presentation outline. Basically, I'm going to present to you the process that Mozambique used to establish this activity, how we selected the healthcare facility here in Mozambique in order to implement this activity, relevant climate hazard that we identified here in Mozambique, and also barrier, lesson, and step forward that Mozambique is following right now. So regarding this introduction, we all know that Mozambique is one of the countries that has a higher risk to extreme weather events. As we can see here, the statistic from Global Climate Risk Index 2021 classified Mozambique as one of the most affected country in the world. And if we try to see, or if we, I mean, from 2021 up now, also the event continued hitting Mozambique, and the impact has been higher here. So in this context, we decided to implement the VNA study, which following the guideline of WHO, and we think that from that guideline, we should be the result that we should have from that guideline. We can be more prepared, adapted, and also to respond to the impact of extreme weather event. So the generation of scientific knowledge about vulnerability and adaptation facility of healthcare facility to climate change, we think that is crucial in order to advance in terms of preparation for any magnitude of extreme weather event. So here in Mozambique, due to the lack of funds, we implemented this study, this process only in 15 healthcare facilities. However, we think that we are going to implement in other remaining healthcare facilities according to the funding availability. So in terms of the process that Mozambique used in order to implement these activities, the CRO/HCF. So the first phase is interinstitutional harmonization of the guideline and checklist of WHO. It means that we had to read to understand those guidelines and from those to decide to discuss which one should be adapted to Mozambique. We know that Mozambique is located in the tropical area where some events like extreme cold, there is not too much, it doesn't happen frequently, but there are some others extreme weather events that frequently happen here in Mozambique. So there was a necessity to understand and discuss and also to adjust the guidelines provided by WHO. And the second phase was the development of the scientific protocol. So here in Mozambique, we shouldn't implement this study or this activity without the approval of the Minister of Health. So the second step is to develop the protocol, and after that, it was approved by Minister of Health, and from there we should implement because we have the authorization to do that. So the phase 3 was to do the training of the multilateral team. As we said before, we had to discuss if other institutions like government, private sectors, public sectors, and the others that showed interest to make part of this process. So after the approval of the scientific protocol, we had to train them in terms of methodology that we are going to use, that we should use, and also to make sure that everybody understands what's the result that we are going to get. And the phase 5, we implemented the pilot. The main objective of implementing the pilot was to see if the questionnaires provided by WHO or using the guideline that was presented before, if everything is okay, or we need to adjust other questions in order to make sure that our target population, we are talking about the healthcare professional that were answering our question, if they could understand, if the language is familiar with them, if we needed to explain more in order to answer to give us the current answer. So that was phase 5, which was the pilot, and after that we decided to implement the study. So we implemented the study in the center of the region of Mozambique, in one province, which is the province. Our country has 11 countries, but we just implemented up now in one province because due to the lack of funds, as I said before. As you can see here, we let me aggravate the point. As you can see here, we are doing the interview here in the healthcare facilities, to the doctors, to the health professional, in order to collect the data that we need to evaluate the vulnerability of healthcare facilities. So how did we select the healthcare facilities in order to make part of this process? The first step that we decided was to assess the vulnerability of Mozambique in terms of health sectors to climate change. So the first study that we have done indicated us that really in Mozambique, main district of Mozambique, they have higher risk to extreme weather events. So as you can see here, 42 districts. It means 27% of the territory and 25% of the population have a higher or very higher exposure rate. So this was the first line in order to identify or to select the healthcare facility that should make part of this process. And we already published this article on April 25, 2024, where we, if you're interested to check it, you're going to find all steps that we use it in order to establish this process. And I think that we already shared the report with WHO Geneva. And after that, because we didn't have enough funding, we decided to select just 50 districts here in Mozambique which would implement is a phase 1 of the implementation of the study. So in those 50 districts, we selected 78 healthcare facilities. And in order to do that, we used the methodology here regarding I can see it here, stratified statistical method, where we can find that we have the significance method is like 5%, and also the test of powers 80%. So meaning that this number, 75 healthcare facility that we selected is representative to Mozambique. However, there is a little bit, we know that every year the vulnerability it tends to increase, and we understand that this number of healthcare facility just a sampling. Maybe if we do have more resources, we could increase the number so that we could have a lot of healthcare facility that should be included. But for now, this is a total healthcare facility that make part of our first phase of implementation. So as a result, the most relevant hazard that we identified in a single province, which is the province where we implemented the study, as you can see here, we do have wildfires and a cool wave as most as a hazard that most affect the healthcare facility. However, as you can see, we also have a higher risk for storm, for flood, and also drought. But cold wave and wildfires are the most that affect the healthcare facilities. So blue represent low risk, the middle one represents the medium, and the red represent higher risk. And that part, as you can see, we have the relative risk from 0 up to 100%. It means that if you see almost all hazard here are between medium to higher risk. So it means that Mozambique needs some intervention that in order to reduce the risk, maybe from medium to low. So we have faced a lot of challenge in order to implement this activity. The first one that we checked is about the questionnaires. Questionnaires are very complex and take a lot of time to finish the interview. It took like 3 hours. So 3 hours interviewing somebody that is working in the healthcare facility in order to attend the patient, so it is a little bit difficult. So some of them tried to give up the interview. So we already identified this challenge during the pilot. So we decided to develop the digital data collection tool. And it was developed here at the INS, National Institute of Health. So it helped us to reduce the time of the interview. How does it help us? For example, if we ask the health professional, like if they have the electrical generator, for example, if they say no, we don't need to ask another question, like if they repair them or not. So basically that we skip, and the system can do it automatically. So it saves us time, and we can interview. We can end the interview in 1 hour or 2 hour maximum. But even so, it takes time, because many of them keep saying like it is not easy because we take a lot of time in order to finish our interview. So the second one is lack of time of head of healthcare facility to attend the interview. They don't have time because they have a lot of things to do in the healthcare facility. So basically they identify, and as a solution to overcome this, they identify other health professionals in order to answer our interview. So, and we decided that maybe it should be a health professional that at least is working in the hospital for 5 years at least. So that is kind of, in order to, the objective of that is must be someone that have a lot of information, because the questionnaires are very deep. So need to be someone that really understand what we are collecting. And the last one, the last challenge is about the lack of funding. The study or our scientific protocol regarding of this activity, it was designed to be implemented in all provinces. As I said, you have 11. However, we just implemented in 1 province. So meaning that we still have a lot of healthcare facilities that we need to assess in order to see the vulnerability and their adaptation level. So, for example, for these 15 healthcare facilities, we just have Global Fund provided some budget in order to implement, but we are hopeful that we are going to have maybe other funding in order to continue with further healthcare facilities. So in terms of lesson, we think that the guideline developed by WHO, they works. They are very important, and they can collect relevant and detailed data regarding the extreme weather event for healthcare facility in our country, and maybe I think that it can be useful to other countries. maybe there should be an adjustment. We have some notes that if there is space, we can discuss. In terms of steps forward as a country here, the first thing that we are going to do is to disseminate the result that we already got from 30 province to decision makers, because we know that if we disseminate this result on them, they are going to take, they are going to implement some interventions like building better, for example, healthcare facility in order to not be vulnerable to some hazard, and also some stakeholders, for example, private sector that have been cooperating with the Mozambican government in order to make sure that the adaptation is a good one. And we are going to do it in September 5, 2024, where we are going to gather all of them to participate in this event to disseminate the result. And the second step forward is to implement the study in the remaining province, as I said before. And the other one, we are already working on the writing in a publication, on the writing in order to publish one more article, which could be the base not only for Mozambique, but for other countries that are going to, that are getting ready to implement the similar activities recommended by WHO. In this manuscript, in this article, there's going to be some session like how to prepare, for example, this kind of activity, the possible results, including some statistical method that we use in order to get the results. So it's going to be like a guideline that can be edited, yes, but can help to establish it in other countries. And thank you so much for attention. That's all.
Thank you, Dr. Américo. I think that was, yeah, thanks so much for giving us insight into the Mozambique experience. And I think what, for me particularly, was so interesting is to show your very systematic approach in prioritizing and choosing the healthcare facilities, because I think this is often a question that has been asked by people who wish also to initiate their process. But the question is which healthcare facilities to choose and how to move, basically. And I think this gave a good insight and very good ideas from which other countries can learn. So thank you so much. Without much further ado, I would like to now hand over to Mr. Maoro Beauvogui, who is the COP26 National Director of WHO Guinea. And I would kindly like Dr. Américo to... Wonderful. Okay, that worked. Over to you, Maoro. And just a note for the English speaking here. Maoro Beauvogui will present in French. So if you have not clicked on interpretation yet, but you're more familiar with English, now it's the time to click on interpretation and choose the English channel. Thank you.
Ok, bonsoir tout le monde et bonsoir chers collègues. Moi, mon nom est Maoro Beauvogui. Je travaille au bureau pays de l'OMS en Guinée. Je suis en charge des questions de changement climatique et la santé. Et nous allons essayer de partager avec vous notre expérience pour renforcer la résilience et la durabilité environnementale des établissements de santé. Et notre présentation va se concentrer sur l'évaluation de l'empreinte carbone des établissements de santé. Et notre méthodologie, nous allons vous parler un peu du contexte général de la Guinée, la méthodologie qu'on a utilisée, les résultats obtenus, on va vous parler des contraintes, des opportunités, les leçons apprises et les perspectives. Ok, comme vous voyez, la Guinée, c'est un pays de l'Afrique de l'Ouest et la superficie, c'est 245 857 km², avec une population environ 12 millions d'habitants et un taux de croissance de près de 3 et l'indice de pauvreté qui est beaucoup élevé, 44 à peu près, et le taux d'alphabétisation, c'est 40%. Et tout le pays, nous avons 3 hôpitaux nationaux qu'on appelle souvent les CHI, et 8 hôpitaux régionaux et 26 hôpitaux préfectoraux, c'est-à-dire les hôpitaux des districts sanitaires. Nous avons également les CNC, les centres communaux, les centres de santé communal. Nous avons les centres de santé améliorés. Nous avons 426 centres de santé. Les pôles de santé, nous avons à peu près 2050. Et les cliniques privées, il y en a au total 200 qui sont répertoriées. Et avant de commencer, je voudrais dire que donc, la Guinée avait fait partie de la déclaration de Libreville sur la santé et l'environnement qui a été signée en 2008. Il y a eu également l'agenda de Luanda qui parle qui découle de la déclaration de Libreville. Et à partir de ces deux éléments, nous avons eu à mettre en place un groupe national de travail avec un arrêté conjoint qui a été signé en 2012, donc l'arrêté conjoint multisectoriel sur la santé et le climat. Et donc, la Guinée a bien signé l'engagement de la COP26 en 2021. Et après la signature de de la convention, c'est-à-dire de l'engagement, et la Guinée a eu à mettre en place un point focal, un deuxième point focal au niveau du ministère de la Santé qui s'occupe des questions de santé et changement climatique. Il y a une direction a été désignée au sein du ministère de la Santé, qu'on appelle la Direction nationale de l'hygiène publique, pour s'occuper de la mise en œuvre des engagements de 26. Et sur la base de ça, on a eu à faire l'analyse des parties prenantes pour voir comment un peu, quelles sont les faiblesses, les atouts et les manquements au niveau de tous les parties prenantes dans la mise en œuvre des engagements de la COP 26. Et sur cette base, il y a eu l'élaboration d'une feuille de route pour la mise en œuvre des engagements de la COP 28. Et les engagements de la COP 28, comme vous le savez, c'est dans deux domaines. D'abord, des systèmes de santé résilients au changement climatique. Et là-bas, il y a eu 3 engagements. C'est mener des évaluations de vulnérabilité et d'adaptation au changement climatique. C'est élaborer le plan national d'adaptation au changement climatique pour la santé. C'est faciliter l'accès au financement du changement climatique pour la santé. Au niveau des systèmes de santé durables à faible émission de carbone, c'est de fixer une date pour atteindre 0 émission. Pour la Guinée, la date qui a été définie, c'est 2040. C'est de fournir une évaluation de référence des émissions de gaz à effet de serre du secteur de la santé. C'est élaborer un plan d'action pour développer des systèmes de santé durables à faible émission de carbone. Donc, voici en quelque sorte les engagements que la Guinée a souscrits lors de la COP26, mais aussi les engagements, il a relevé les mêmes engagements dans le cadre de la tâche. Et donc, nous, en tant que l'OMS ici, donc, nous essayons d'appuyer le pays, le ministère de la Santé, à mettre en œuvre ces engagements. Et c'est dans ce cadre-là que nous avons eu à appuyer le ministère à conduire l'étude de VIET, l'évaluation de référence des émissions de gaz à effet de serre. Cette évaluation a été faite en suivant une certaine méthodologie qui est résumée en 5 étapes. La première, c'était de faire d'abord le cadrage de l'étude. Le cadrage a consisté d'abord au choix des hôpitaux et après la mise en œuvre en place d'une équipe restreinte et donc composée du ministère de l'Environnement et du Développement durable, du ministère de la Santé et de l'Hygiène publique et des partenaires techniques. Donc, au nombre, l'équipe restreinte était composée à peu près de 7 personnes. Au niveau des hôpitaux, et nous avons eu à choisir les 3 centres, les 3 centres universitaires, les 8 hôpitaux régionaux, les 26 établissements, hôpitaux préfectoraux, les 9 CMC et les 2 hôpitaux d'entreprise. Au total, au début, on avait sélectionné presque les 60 grandes structures du pays. Et la deuxième phase a été le renforcement des capacités. Nous avons utilisé l'outil AKDN pour la gestion et le calcul des émissions. Et donc, il y a eu d'abord un renforcement des capacités sur l'outil. Et on a eu à former au niveau national, nous on appelle ça la formation des formateurs. Et il y a eu 5 ateliers de formation pour former 60 agents et, au niveau des structures sanitaires qui ont été identifiées. Après, la troisième phase a été la collecte des données sur le terrain. Et donc, la collecte des données au niveau des formations sanitaires. Les données qui ont été collectées, ça concernait l'énergie, les sources ça portait sur l'énergie, le transport, les infrastructures, les équipements médicaux utilisés, les techniques de gestion des déchets, la logistique, etc. Il y a eu également des missions de supervision par les experts au niveau de ces établissements de santé pour savoir, pour appuyer la collecte des données au niveau des établissements de santé. Après la collecte des données, nous avons procédé à la validation des données. Et donc, la validation, après la remontée des données au niveau de la Direction nationale de l'hygiène publique, nous avons organisé un atelier technique de validation des données avec la participation des directeurs ou bien des points focaux des hôpitaux qui ont contribué à la mise en œuvre de l'étude. Et après la validation des choses, donc, nous avons procédé à l'élaboration du rapport. Et le rapport, après, dès qu'il a été élaboré, il y a eu d'abord une validation technique par l'ensemble de la plateforme santé et changement qui a été multisectorielle, la plateforme multisectorielle sur la santé et le changement climatique. Et nous avons intégré les observations et nous avons essayé de valider le rapport au niveau politique, c'est-à-dire soumettre au niveau du gouvernement ou bien du ministère pour voir quel est leur point de vue. Et après ça, nous avons essayé de partager le rapport avec également les collègues du bureau HP de l'OMS. Donc, en quelque sorte, le schéma, ça a été ça. Donc, il y a d'abord la définition de la portée, le renforcement des capacités, la collecte des données d'information sanitaire, la validation et le traitement des données et l'élaboration du rapport. Le résultat, on peut dire que ça nous a permis de connaître les estimations, de connaître l'émission dans notre structure de santé. Donc, à terme d'émissions annuelles de gaz à effet de serre, il est estimé à presque 14 337,8 tonnes équivalent carbone. Avec les structures que nous avons, c'est ce qu'on a retrouvé. Et le scope 1, ça veut dire quand on prend par domaine, le scope 1, on a trouvé à peu près 5000 et quelques. Et le scope 2, on a trouvé 900. Et le scope 3, 8000. Et l'autre, quand vous regardez au niveau du graphique, vous trouverez que tout est résumé ici. Au niveau des déchets, donc les déchets contribuent à peu près à 3% des émissions des établissements de santé. L'électricité, par exemple, la production d'électricité à partir des groupes électrogènes contribue à 7% des émissions des établissements de santé. Il y a également le déplacement, les véhicules utilisés pour le déplacement, ça contribue à 9%. L'utilisation des gaz frigorigènes, c'est-à-dire les climatiseurs, la climatisation des salles et les morgues et tout, contribue à peu près à 16% des émissions. Ce qu'il faut retenir, c'est près de 56% ou bien 56% des émissions sont dues à la chaîne d'approvisionnement. Et en termes de contraintes, nous avons eu, il y a par exemple les fonds qui avaient été, il y a un problème de fonds qui était posé, et ça ne nous a pas permis d'aller dans toutes les structures qu'on avait souhaitées, ou bien ça nous a limité dans le choix des structures. Parce que si vous voyez, dès le début, le nombre de structures qu'on avait souhaité, on n'a pas été dans les centres de santé, on s'est limité seulement au niveau des grandes structures parce qu'il n'y avait pas, le financement n'était pas si élevé. Donc, on a été également confronté au manque de données au niveau des structures parce que les données qu'on demande de fois là, ce n'est pas facile à avoir accès parce que c'est des données qui parlent de fois des finances, qui un peu de demande. Alors, nous, en la période de la pandémie que nous étions, les conditions politiques, je peux dire, ça n'était pas favorable. Quand tu partais vers un directeur des hôpitaux, tu lui demandes les factures, tu lui demandes les données, il y avait un peu de réticence. Donc, ça avait été un autre problème. Et il y avait également le problème des difficultés de compréhension de l'outil dans sa version anglaise. Bon, nous, on peut comprendre, mais au niveau des établissements de santé, les gens qui ont été formés avaient des difficultés pour comprendre l'outil, ce qui a fait que des fois, même nous-mêmes, on était obligés d'aller sur le terrain pour collecter les données avec nos collègues au niveau du terrain. Il y avait également un problème de disponibilité, de motivation des agents lors de la collecte des données, parce que le remplissage faisait un peu de problème. Quand vous allez, et je pense que mon collègue aussi de la Mozambique a dit, pour collecter toutes ces données, il faut à peu près une journée, 2 jours, vous faites 2 jours sur le terrain, vous ne faites qu'à collecter, vous partez par-ci, par-là, donc c'était un peu annulé, donc les gens ne trouvaient pas assez de temps. Et en plus, nous avons, comme leçon apprise, nous avons vu qu'il y a eu une bonne collaboration entre l'OMS, AFRO, jusqu'au niveau pays ici. Nous avons également vu qu'il y avait Agacan également qui avait appuyé le processus parce qu'il intervenait lors de la formation des formateurs. Il y a eu l'engagement des autorités au niveau central, c'était beaucoup mobilisé parce que quand on avait des difficultés sur le terrain, au niveau central, on appelait le niveau central et ils intervenaient directement, les gens prenaient action. Il y a eu une bonne implication donc également des structures sanitaires après l'intervention par exemple de la hiérarchie. Et comme perspective, avec les résultats obtenus, nous comptons élaborer le plan national d'atténuation du carbone du secteur de la santé. Parce que ça dit, nous comptons élaborer ce plan pour nous permettre de mener les actions concrètes. Donc, il y a également, nous comptons également mobiliser des ressources pour la mise en œuvre de ce plan qui va être élaboré. Mais aussi, nous continuons le plaidoyer pour la prise en compte de la santé dans les documents nationaux de la Convention cadre des Nations Unies sur le changement climatique. Notamment, la santé n'était pas prise en compte dans la contribution nationale terminée, qui est presque l'outil principal de l'accord de Paris. Et pour que la santé soit prise en compte dans le plan national d'adaptation qui est en cours d'élaboration, mais aussi dans les communications nationaux, qui sont entrés dans les communications nationales, et que chaque pays élabore sa carte et le soumettre à la Convention cadre des Nations Unies sur le changement. Donc, en quelque sorte, il n'a pas été très long. Et c'était ce que je voudrais partager avec vous. Merci.
Thank you, Maoro. Thank you for this presentation, and thank you for very openly sharing with us the journey in your country. I think what's always also very important and interesting to hear is kind of on the lessons learned and the constraints. Yeah, just to know that multiple to overcome that. And this is exactly what we're going to talk about now in the group work. So those who have already visited one of our webinars may be familiar that we will divide you in breakout rooms. You will be randomly assigned to a breakout room today because we are discussing the same topic in all of those breakout rooms. For those of you that require interpretation, when it pops up on your screen, you can click not now, then you will stay in the main room. Even if you accidentally land in a breakout room where there is no interpretation, you can still have the option to come back to the main room. Yeah, I think these were the main points, and all the rest will be explained by my colleagues in the breakout rooms. So see you on the other side. We have just a little bit time left, and maybe we do a very quick round of reporting back in the plenary. Maybe 1 minute.
Yes, exactly. So maybe starting with room 3, I think Dr. Spirit will be reporting back to the discussion been going on in room 3.
Wonderful. So just very quickly, so everybody can get in. One of the things that we recognize with the challenges and barriers is a general lack of knowledge, and whether that is at the individual capacity building or at the highest levels of the professionals that are necessary to move the needle. There is a general lack of understanding, a general lack of recognizing where their power is to effectuate change, and just a general lack of knowledge about where funding and everything else should come from. What we know in order to overcome these barriers is that we really have to look at the utilization of support in terms of procurement, capacity building, and really leveraging solar energy, looking at ways to really ensure that as we move forward, climate resiliency is at the front of our capacity building. And last but not least, we need to look for ways in order to bring people together collaboratively to work on enhancement and sustainability of these healthcare facilities. If we don't work together collaboratively across stakeholders, then we will continue to be individual silos barely moving the needle.
Thank you so much. I think really, really important points. Very quickly to Dr. Rachel.
Is it me now?
Yeah.
Oh, sorry. Yeah, we had spoken about a top-down approach and a bottom-up approach, because we need to get the architects, the engineers, the contractors to have interest in actually building resilient healthcare facilities. But if they're not aware on the medical side, which is where the medical students come in, because I had mentioned that to get the administration involved, the students can pressure them from inside, because if they're not aware, we have to educate them.
Thank you so much. And I'll be reporting back from the discussion that we have in the breakout room, just following you, Dr. Richard, with the same point, the importance of pushing, the importance of advocacy and raising awareness on the higher level to just to push things and to let's say to promote more the importance of this topic. And we somewhat have had a little shy discussion at that breakout session, but it was very stressed out this very important issue of raising awareness and advocacy within the health policymakers at the higher level, the engagement of communities in deciding what would be implemented within the healthcare facility, since they are the end users of these healthcare facilities, and engaging them also from the beginning about raising awareness within the community, so they also can put more pressure on policymakers and decision makers to actually implement and enhance and improve the healthcare facilities. So last but not least, to our dear colleague, Dr. Waltaji, to report back from Rome 2. Dr. Waltaji.
Yes, thank you very much. I think in our group, we discussed a little bit on the undertaking on how this the healthcare facility assessment. I already also shared the Mozambique experience. What we have raised here is, we highlight is the need of having the overall vulnerability assessment, because the healthcare facility, for example, in some country, we are having more than 2,000, 3,000 healthcare facility. There is no way to conduct in all healthcare facilities. So having the overall vulnerability assessment report, is particularly at the district level, is very important when we want to do the healthcare facility. So we can pick that from based on the vulnerability level of the district, while stratifying based on the category of the district vulnerability level. You can pick the healthcare facility both for the vulnerability assessment and the carbon footprint. That is one of the important we raised. And then the second thing is the country ownership, capacity building for the national expert, for them to own, and then also to use the result for the generated evidence to use for the planning of the healthcare, a resilient healthcare facility. For that, there is a need of including the language translation. For example, in Mozambique, the English version was translated before starting any work. The first step of translating those checklists to the Portuguese. Now, from that experience, I'm suggesting to translate, country can translate to their national working language, where the expert can understand very easily. So those are the things. And then the main challenge was the funding issue. As we have funding challenge, we need to do in selected healthcare facility. If you remember, Américo presented all those 78 healthcare facilities, they represent Mozambique. So I think as we don't have the budget, so we need to focus on the randomly stratified or randomly selected healthcare facility. And very important also to have the baseline VA, and that way we can solve the funding problem, and the ownership is very important. Thank you.
Thank you so much, Dr. Waltaj. Indeed, very, very important highlights and points discussed. So thank you. This is very interesting and very, let's say, fun also discussion to have it. And I was very pleased to be part of this webinar. So with that, I will hand back to Yiqi for closing remarks of the webinar. Back to you, Yiqi.
Thanks, Saleh. Not much to say, I guess, from my side. We're also a little bit over time because there was a very interesting, engaging discussion, and I think we all got caught in the moment, and yeah, very, very motivated to engage more. So thank you so much, everybody, for participating. Great thanks, of course, to Saleh, to Amy, and to the country representatives who are here with those great examples. We will share the recording and also the slides later on our website, and we will send you the email, so you can be sure that you'll be able to access it all. And then, yeah, I wish you all the best and hope to see you soon in another webinar. Bye.